Thank you. Thank you, Dr. Batnelli. Thank you. It definitely feels lonely up here compared to the other fireside chats. Is Dr. Murthy on? Just while you guys bring him up. So, I have the honor of being here today and seeing so many healthcare leaders in the room. It was only 3 years ago when Michael Dowling did take a stance on this issue and allowed us at Northwell to start the center. And at that time, as he's mentioned numerous times, it was so hard to get a number of healthcare leaders to the table. But you have inspired all of us on the front lines that we need to act, that this needs to be a part of our culture change, and we need to move forward. So it's really, with my honor today that I get to introduce the Surgeon General, Dr. Vivek Murthy. I won't recite his full biography, but as all of you know, he served as Surgeon General under President Obama and led us through a number of public health crises, including Ebola, Zika, and is now back for a second stint and has really led us through the COVID-19 pandemic. He's one of the most trusted, thoughtful voices in America. And Dr. Murthy, thank you so much for being here with us today.
Well, thank you so much, Chetan. It's really wonderful to be with you. Yeah, I really appreciate the opportunity to have this conversation with you. Oh, I think there's a bit of a delay, but we'll figure it out.
Perfect. All right. I'll just pause. Us too, Dr. Murthy. So you heard today the devastating stats, right? Recent CDC data shows last year 49,000 Americans killed. Guns continue to be the leading cause of death among kids in America. At our children's hospital here, Dr. Murthy, we saw a 350% increase in the number of kids coming in with bullet wounds last year. 350%. This year alone, we've seen kids riddled with bullets from gang violence. We just saw a child who was shot in the back of the head. His brother accidentally shot him in the back of the head. We saw another girl paralyzed in the neck, shot in the neck with a totally transected spinal cord. We all know on the front lines the devastating effects that bullets have, particularly among children. You have a number of competing public health emergencies, public health issues to deal with as Surgeon General. Can you tell us, is gun violence a true public health emergency in the US? And if so, please tell us why.
Well, thank you, Chetan, for that question. And I just want to start by saying thank you to all of you at Northwell and those who are attending who have provided leadership on this issue. I do want to build on something you said in your opening remarks, which is that in the early days, trying to call attention to this issue, it was hard to get people to the table. And particularly in the healthcare setting, where I think people were worried about whether it would impact, their relationships with patients, whether it was too politicized an issue to get engaged with. But the numbers tell us that we can't look away any longer. The stories tell us even more compellingly that the price that's being paid by children and families and communities is just too high for anyone to bear, and certainly shouldn't be, a price that our country should be bearing. We have to do something about this. In addition to the numbers you mentioned, nearly 50,000, gun violence-related deaths. I think as a country, we don't pay enough attention to those people who may still live but are deeply impacted by gun violence, the people who are survivors, the family of those survivors, and all the people who hear the stories and witness what has happened and worry for their own safety and who may deal with that trauma for months and years thereafter. That is the broader price of gun violence that we're paying. And it was so disturbing for me, not just as Surgeon General, but as a father, to see that gun violence has now become the number one cause of death among children, which is just unfathomable and just unacceptable. I also just think, sometimes we look at these problems that have persisted for so long, that have been caught up in the sort of quagmire of politics, and we think, well, this is just the way it is. This is too hard to change. But there are a couple of numbers I like to keep in mind whenever that thought surfaces. And it's this. In 2020, Canada had 5 children die from firearms. Switzerland had 6. France had 8. Sweden had 9. Australia had 11. Germany had 13. The UK had 15. The United States, we had 4,357 children die from firearms in 2020. if that doesn't tell us what we need to know, that we are an outlier and not in a good way, then nothing else will. But it's an urgent call for us to act and to take this seriously. And I do want to say that in this effort, that the voices of people in medicine and public health could not be more important, because we are voices that are trusted by the American public. People trust those who deliver care to them, who understand their communities, who know their families. And this is a moment where, like the healthcare world has in previous instances when it came to addressing motor vehicle accidents and other public health threats, this is one of those moments where we do have to step up and engage and advocate and lead, because our kids are depending on us to do that. And I think many of us come to this not first, with our professional roles, but as parents, as grandparents, as community members, as sons and daughters ourselves. And I think that's the story, that's the identity we have to bring to this work that's so urgent. Because people all over the country, when I travel around the country and talk to communities about gun violence, people are asking who's going to help us find a better path forward. And I believe that healthcare, leaders in our community, nurses, doctors, and others on the front lines, they're the right ones to help lead us forward.
That point just resonates so much, because it is healthcare, to your point, and public health agencies that transcended the polarization with substance use, motor vehicle safety, and tobacco cessation. And I think we have a big part to play. And it's interesting, the point about Canada and other countries. People often forget that the regional gun ownership rates across many parts of the US are actually not that different regionally than countries like Canada, but a strong public health approach, to your point, has really mitigated a lot of the gun injuries there. So as you know, we have a number of healthcare leaders in the room today: CEOs, corporate leaders, researchers, and so on. What is it that they should be doing when it comes to gun violence prevention as a policy issue and beyond?
Yeah, well, I think there are a lot of things that CEOs and leaders of healthcare systems, educational institutions, and other health institutions can do. I think, number one, we should make sure in our clinical settings that we are, in fact, talking to patients about firearm injury prevention. That involves screening, it involves engaging in terms of interventions. This is something I want to commend Northwell on for the job that you, Chetan, and your team there, has done in really equipping clinicians with the tools to start these conversations, and that's essential. But just in the same way that we make it a point to ask people about tobacco use, about physical activity, about whether they're concerned about safety at home in terms of domestic violence, we should make it a point to ask on a regular basis about firearm injury risk. And then provide people with their resources so they know how to reduce their risk. So that's the first. I think the second is we know that there has been a need for more research to understand the drivers and solutions to gun violence in our communities. Now, for decades, that research funding was choked off by Congress. Recently, in 2018, I was really glad to see a bipartisan effort come forward to finally provide some initial funds to support gun violence research, but we need a lot more. And in our institutions as well, our healthcare institutions, we need researchers and investigators who are supported in their efforts to study these issues. So advancing that research in your institution is a second area. And I'm not just talking about sort of traditional research in terms of like looking at, databases and numbers, et cetera. I'm talking about getting out into the community, about asking community members, how do they view this issue? What are they concerned about? What solutions do they think would work? Because this has to be a community-driven effort. I think the third thing that leaders can do in institutions is recognize that we have to support our staff. I really worry deeply about what's happening to clinicians all across America. And on top of the terrible burden the pandemic placed on them, in addition to the large administrative burden that they were facing before the pandemic, many clinicians are struggling with the trauma, of seeing gun violence victims come into emergency rooms, of managing the ongoing challenges that many gun violence victims face if they are fortunate enough to survive, being shot. But there's also an impact we have to recognize on the clinicians themselves in their personal lives. Many clinicians are parents and who worry about their kids going to school and worry about what may happen, on that given day in terms of an episode of gun violence at school. Many are our family members who wonder, is it safe to go to the grocery store anymore, to go to the movie theater anymore, to go to concerts, to do the things that we enjoy doing or used to doing, but somehow have become laced with danger because of the uncontrolled epidemic of gun violence that we have. There's one last area where I think CEOs can make a big difference, and that's to be public advocates. We need leaders to stand up and to make it clear to the public and to policymakers that this is no longer an issue that we can put on the back burner, that we can push to the side because it's difficult. But this is a time where we have to do hard things, have to have hard conversations, and take steps, to actually put policies in place that will protect all of us, especially our children. I was glad, Chetan, that we were able to, as a country, pass the Bipartisan Safer Communities, Act, and finally take a step forward after so many years to make the investments in supporting mental health and supporting community violence prevention programs that we've needed for a long time. That's an important first step, but it should not and cannot be the last step that we take. There's so much more that we need to do to address gun violence in our communities, and that needs the advocacy of leaders in the healthcare setting.
Absolutely. Let's drill down on a couple of those points because they're extremely salient for this conversation. The point about screening, how to have the conversation, and I think this is a point that extends beyond healthcare. As you know, there's a number of public awareness campaigns surrounding parents, right? Just the idea of having this conversation, and I know here, we at first struggled with having that conversation, normalizing this topic with our patients. How do you actually bring up gun violence screening, firearm safety counseling, and so on? Do you have any advice for people in the audience today on how they can raise this uncomfortable topic, how they can transcend the polarization that we all feel in our communities around this?
Yeah, I'm glad you asked that. Yeah, and and Chetan, rather, I think, Chetan, the truth is that in medicine, I remember when I first started medical school, that old saying that we were all taught, see one, do one, teach one. We learn from each other, right? And I think that's why having places like Northwell, having teams, Chetan, like yours, that have actually done this and helped support clinicians is so valuable, because when you share your experiences, your sort of structure and methodology with other hospitals, it gives them the tools they need. I know that there are other resources that have been created. UC Davis, of course, has the bullet points, sort of like a paradigm which has helped create a simple algorithm through which you can actually have that you can use to structure your conversations with patients. But I think there are a few things that are also important to recognize here. One is that because of how politicized gun violence has been, I can understand how, a nurse or doctor going to a conversation with a patient might think, gosh, is this going to be awkward? Is it going to become antagonistic or confrontational in some way? But what's important for people to know is that the data actually does show that when clinicians have these conversations about firearm safety, that gun owners and non-gun owners alike actually both appreciate the conversation. So that's important to know. The second is that as a profession, we have had to take on and engage in conversation on issues that sometimes either feel uncomfortable to us initially, or that seem like they're perhaps not right. I think about the conversations that we have to have with patients about issues like smoking or sexual health or mental health. These are all issues that were taboo years ago, but clinicians got comfortable over time talking about them because they realized they needed to, because they were so deeply tied to health outcomes, and also because, and this is really important, because on issues like this that are sensitive, sometimes there's nobody else that's going to ask a patient about them. Sometimes there's nobody else that they may feel comfortable having a conversation with, but you could be the one who opens up that conversation, helps them recognize that, hey, that there is risk in their life, but risk that can be mitigated, and that in turn could save a life. We do this with issues that we don't normally think of, or the society may normally think of as being in the lane of clinicians. We ask parents about whether there are swimming pools in their home, because we want to make sure that precautions are being taken to prevent children from falling in the pool and drowning, right? We ask people about seatbelts, not because we're motor vehicle experts, but because we know that that intervention saves lives. And here too, I believe it needs to become part of how we approach our patients to talk about how to reduce the risk of firearm incidents that could cause injury and death. And this is a place where I do think that we can make a big difference. And so I would just encourage our clinicians to recognize that we are needed here, that there's precedent for us engaging on issues like this in order to save lives. And finally, when we do, not only do patients appreciate it, but families do as well, because sometimes a family member may be looking at a situation in their home where there may be a gun that's not stored safely, and there may be children in the home, but they may not know how to start a conversation with a family member who's responsible for storing those guns safely. But when you step up and you do that, when you open that conversation, again, it can be to the relief of other family members as well. So I know this isn't easy, and I just want to recognize that we ask so much of our clinicians, especially our primary care doctors, where we ask them to do more and more and more with less and less and less at times. And this is why I would also say to the leaders of health systems that we need to find ways to make this easier for clinicians to do. And that means providing them with the simple training and structures to have these conversations, but it also means finding ways to take some of this work off of their plates. Yeah, doctors and nurses are not the only ones who can have these conversations or start to gather some of the data that we put into questionnaires regularly for other conditions. So this has to be a shared responsibility of a healthcare system to have these conversations with patients.
Yeah, no, we were seeing some nods in the crowd. I mean, I think to that last point, institutional leadership is so important because this involves everybody from the clinician to the administrator to your leader to the nurse to the tech, right? And you don't get that without institutional leadership. And I think that's what this is about. And then on top of that, community partners, right? Like Erica Ford, she meets me in the hospital when we have a gun injured patient. She is that credible messenger. She's able to inform us as our cohort of gun owners and other community groups. So that's incredibly important. How many people in the room, as part of their practice or in everyday conversations when they're sending their kids over to other people's houses, actually have these conversations about firearm safety? Ask about safe storage. Extremely limited in a room focused on this topic. So I think there's a lot of opportunity here, to your point. The last question, I only have a couple minutes. Dr. Murthy, you've focused and done such incredible work on burnout, particularly among healthcare workers, and how they can mitigate this. And as you know, it's incredibly frustrating to have to treat gun-injured kids, adults, on and on, without any end in sight, right? But we are here for optimism. We know that great things have been happening, but that doesn't take away from the trauma of actually experiencing this as a frontline worker. What advice do you have to the healthcare system when it comes to actually supporting employees and the secondary burnout that they have from just exposure to this trauma?
Yeah, Jathan, thank you for asking that question. This, I think, is one of the great risks to health in the United States, is the burnout that we are witnessing before our eyes. It's taking place and in many ways accelerating among health workers. It's one of the reasons I issued a Surgeon General's advisory on this issue on health worker burnout last year. It wasn't just for the healthcare profession. Many of us know how burned out we and our colleagues have been, right? But it was for the broader public, because I worry that the public doesn't fully recognize the depth of what is happening in the health profession and the consequences that burnout and then dropout from the profession will have on their access to care. So that is why we issued that. But I do think that we laid out, by the way, I should also say, a number of steps that institutions can take to help address burnout. And all institutions, government, healthcare institutions, electronic medical record, organizations, health insurance companies, and on down the line. But I think specifically to your question about what institutions can do, I think number one, acknowledging the load that clinicians are carrying, the burden of that trauma that they experience, and as they deal with the challenge of gun violence in their communities, and as they worry about their own families, that is really important because it's one of the biggest hits to morale is when you feel like your leadership does not understand or appreciate what you are going through. So that is number one. Number two, we have to show up in ways that offer material support to people who are in fact struggling. And the truth is, it's not easy to tell who's struggling, right? We, especially in healthcare, we've become like professional experts at putting on a brave face and hiding, our struggles, sometimes even from ourselves. And none of that is actually good. I think that can be detrimental in the end if we don't deal with that stress and strain. And so to me, that dealing with that, offering material help, means making mental health services available to people who are struggling, proactively engaging with clinicians to understand how they are doing and not waiting for them to raise their hand and ask for help. This proactive approach, by the way, is one that I saw in New Haven, Connecticut, when I went to visit some time ago and spoke with folks at the Yale New Haven Health System who recognized that if they just waited for people to raise their hand and seek out help, they were just missing lots of people who, for one reason or another, did not go. But when they proactively engaged people just to do an intake, just to check in, see how folks were, they found they identified many more people who needed help and were able to connect them to resources. I would also say that with regard to help, making it easier for people to get help is really important. And this is where virtual care is really vital. There's so many nurses I spoke to around the country during the pandemic who said, we want to go and get some help and get some counseling support, but we're working 12, 16 hours, a day. We're often working night shifts and then switching to day shifts. Like, when are we supposed to actually go and drive 30 miles to have an appointment? But if there was a virtual capability in our hospital where I could sit in a room and get care, I would do it. That's what I heard again and again and again. Making sure that those virtual options are in fact available can be immensely helpful as well. And then finally, I think, well, two last things I'd say. One is, we know peer support is important here as well. When I was an intern training in medicine, I remember one of the most important things that our program created for us to help us deal with a lot of the stress and strain were peer groups that met once every few weeks for 45 minutes, just to be able to share what we were going through and support one another. We weren't trained mental health therapists, but community matters. And a lot of people struggle in silence alone. But having a peer community that a health system helps support the creation of can go a long way. But finally, just consider this. One of the most corrosive feelings and stressful and diminishing feelings that you can go through when you're dealing with gun violence is the feeling of helplessness, a feeling like, this problem is getting worse and there's nothing that we can do about it. But when you give people an opportunity to see that you as an institution are being a part of the solution, that you're advocating for what needs to be done, that you're creating opportunities for clinicians themselves to use their voice in the public square and in research and in other ways that can be constructive, that makes a difference. It gives people a way to feel helpful in addressing the root cause of the problem. So these are all ways that institutions, I think, can help address the deeper challenges that people are going through. But lastly, I know where time is coming to a close. I just want to say this, this issue cannot get lost among the many issues that we're dealing with from a public health perspective. To me, this is more than a public health issue. This is a moral issue. It's about whether we are going to sit by and allow thousands of children to die each year and many millions of children to walk through their lives feeling scared and worried that this is the day that they're going to show up to school or go to the mall or go to the movies and there's going to be a shooting. That cannot and should not be how our children live. That's not what I want for my kids. It's not what I want for any of our children. And so the sacred responsibility, I believe, of any society is to take care of its kids, to set them up for a healthy, fulfilling life going forward. We have work to do to fulfill that promise and that moral responsibility we have to our youngest and most precious members of society. And that's why this has to be a priority. That's why we can no longer allow politics or division or interest groups to stand in the way of us getting to solutions. As those of you who are in healthcare, whether you're on the front lines, whether you're leading institutions, whether you're coordinating care, your voice has an outsized impact here because the community knows that you're there dedicated to health. And that means that you're trusted. It means that your voice has weight. So use those voices to advocate for solutions, to drive for successful programs in your communities, to have conversations with patients. They make a difference and they will inspire others who look at this problem and wonder, can we do better? Well, we can and we must.
Thank you so much, Dr. Murthy. Institutions that act provide inspiration for their employees, and I think that was, such a salient point. So thank you for being with us and for your advocacy. Thank you so much.